Well, I'd like to welcome today Dr. Edward Cherney. He is Associate Professor at the Vanderbilt Eye Institute in Nashville, Tennessee. He specializes in retina. Thank you, Dr. Cherney, for joining us today.
You're welcome.
I want to let our listener know a little bit about your background and what made you decide to go into ophthalmology.
Well, first, I'm a third-generation physician, so that sort of came up in my upbringing. And I went to medical school at UCLA, and I was headed towards a surgical residency, and it was particularly specialty. And my mentor said, "No, don't choose that one. Try to choose ophthalmology because they're just starting to do things in that specialty they've never been able to do before. It is up and coming." So I took a rotation at the Jules Stein Eye Institute, and I just fell in love with ophthalmology. And there's a whole variety of reasons. Everything from, for me as a physician, I'm able to use my general medical training, and as well as we did surgery and microsurgery, so it was a great mixture between medicine and surgery. And my particular specialty is the retina. And in that, we have to stay up on treatment of everything from diabetes, because that affects the eye. We have to understand neurological problems, everything from multiple sclerosis to tumors, because that also can affect the patients that I see. So it's a very stimulating subspecialty, and I've made my choice, and here I am.
I understand that you see quite a few different types of patients here in Nashville. You have a private practice as well as in part of your private practice helping to serve the underserved communities in Nashville. Tell me a little bit about that, your experience, and different things that you see with regards to disparities in healthcare.
Wonderful question. And I'm a little bit of an odd duck in that I spent 30 years as a solo private practice physician before coming to Vanderbilt. And my general philosophy and thoughts were the same in private practice as they are here at Vanderbilt, where I see patients from the university. I go to the local county hospital, and we also take care of some of the uninsured as well. And there are a variety of things. I think that to be successful, you have to be honest with yourself and honest with the patients. You have to treat every single patient as if they're your brother and your sister, which they are. And to me, it makes no difference if they are black or white, Hispanic, if they have a lot of money or if they have no money. These are people who need help. I get that very, very strong feeling from my father, who did an incredible amount of charity work, and he was a private physician, solo practice in San Francisco. And I think that's just part of the internal proportion of who you are. If you do choose medicine, it should be something that you choose because you want to do it and you want to sincerely help people, and they will come first. If you want to have a good practice and if you want to take care of them from the deepest part of your heart, you treat everybody as an individual. And they're not a disease, or they're not a detachment room for Mrs. Johnson, and that's very, very important.
There is a push now in our education as physicians to have more knowledge about different cultures. And I know specifically for you do some work in Russia and help with education there. Why is it important for us to know about different cultures? How does that impact our ability to be effective physicians?
I think that when a patient comes in to see you, they are bringing their culture in with them. But deep down, they are still an individual, and we still have the same hopes and dreams and fears. And when people come in some cultures, I've worked for 20 years in Russia. They will not ask questions. They will think that whatever you say is it. But deep down, they will have a fear of what they have. And you have to anticipate that and answer the questions. You have to know the diseases and know what the individual fears are. Some cultures are very outgoing and they're very demanding, and they're going to ask you one question after another, and that's wonderful. But there are other patients, due to their cultural, they will hold back and they will take their fears home, and it's your job to be aware of this. And not only in talking with the patient, many times as you're talking, they will have a brother, sister, mother, father in the same room, and you need to watch the interaction between the two. And many times you also have to talk with the person who's sitting in the chair, not the exam chair, because that's maybe the person who's going to be the dominant factor in the relationship. So that is something that you just have to be aware of as well.
So if I was a young person listening to this, I would say, well, that's starting to sound really hard. I have to know all my knowledge about medicine, and then I have to understand everything about the patient. How can I possibly do that?
It's not difficult. And there are many times that it is difficult to start out with, but if you again turn down, there will be patients, and you have people in your own life that'll drive you nuts. And be aware of that, but don't take that out on that particular person to deal with it. And there are other people who are very demanding. You just have to sit back, take a breath, and really try to figure out what's underneath that. And when you do that and you get that personal relationship, it is so rewarding because many things come out. It is not difficult. The first 1 or 2 or 3, maybe the first 2 or 3 years, yes, things are difficult for all of us when we start out. The more you do it, the easier it becomes and the more rewarding it will be.
If you were to leave our listener with one piece of advice or several pieces of advice, just give us some of your pearls of wisdom.
I think the first one is when the person's in the room, you don't think about anything else but them and their problem, and you treat them like your best friend, and you show concern with them, you give them eye contact, you listen to them, and you empathize with them. You don't take their problems home with you, but when you're there in that room, you are there 100%, and you have to honestly care for them, and that's the take home.
Thank you so much, Dr. Cherney. I'm sure that everyone hearing this will not only learn a lot, but also just gain another dimension to their ability to be not just an effective physician, but an overall effective person in everyone that we deal with in this world. So thank you so much.
Thank you, and good luck with your career.